Hello, this is Dr.R.S.Sonawane, psoriasis homeopathic specialist. Today we will know about a rare type of psoriasis. You see, for any disease like a psoriasis or any other disease, usually there are very few types. But psoriasis is a very funny disease. In this there is no one type of psoriasis. For example, last time we saw the scalp psoriasis and the plaque psoriasis, which are the very commonest type of psoriasis. Almost 80% of the patients get those, but there are certain rare type of psoriasis which do not look like a normal psoriasis, and that is why it is very difficult to diagnose or identify. And if they are not identified, they are not diagnosed, it's difficult to treat them. So we must know about this rare type of psoriasis. The first rare type of psoriasis is a guttate psoriasis. So what we see in the guttate psoriasis, it's entirely different than the normal psoriasis. So guttate types of psoriasis, we notice that usually it comes after certain infection of the throat. For example, tonsillitis, pharyngitis or malaria. So especially it is found in children and young people. So they get an infection. And after the infection is over, they get some skin rash. For example, they get some small spots called as guttates, small pink color, some spots all over the body, especially on the front. And they are not having much scaling. Usually, initially, people notice it as if it is a side effect of some antibiotics or some, and they are again given some antibiotics. But it goes by those antibiotics also. It comes like a game. Then they notice that it is not the effect of some medicine or side effect, but it is a psoriasis, a guttate type of psoriasis. It is a small pink color nodules, especially on the ground. Many times it also contains water. So that is a water containing pimples on the body. So this is a guttate psoriasis. Usually it occurs in small children and young people. And moreover, if in this psoriasis there are more chances, those people who are in guttate psoriasis, to get the psoriatic arthritis. One of the type of arthritis common in psoriasis patients. The another type of psoriasis, rare type of psoriasis, is an inverse psoriasis. So inverse means what? Inverse means usually it occurs in skin folds. So we notice that inverse psoriasis, it occurs inside your armpits, under the breasts, in the groins, or in skin folds. Those people who are obese people, they have this obesity and their skin folds. And underneath the skin fold, the skin becomes a red, or in the axilla, in the groins, under the breast, the skin becomes a red, shiny. There is a lot of itching. There is no scaling, but there are cracks. Usually, this psoriasis, inverse psoriasis, is best diagnosed as a fungal infection, and it is treated as a fungal infection. One more important thing, repeated fungal infections can lead to inverse psoriasis, or all those who are having this type of inverse psoriasis. Since there is a moisture in the folds, it can lead to a secondary infection of a fungal type. So fungal infection is common in the inverse type of psoriasis. So they have to take care of both, not to have any fungal infection. So as in other type of psoriasis, we are advised to use the moisturizer. Here the doctor advised to keep it dry. Use some antifungal powder. So this is one type of psoriasis. So usually it is on the inner parts, and people do not usually go to the doctor immediately, or they are shy to go to the doctor. So it's better that immediately go to the doctor. It's very painful and the cracks comes out. So this is a rare type of psoriasis. Then there is a third rare type of psoriasis, which is one of the dangerous type of psoriasis. It's an erythrodermic type. As erythrodermic, what happens to all over body, suddenly the skin becomes red, inflamed, and there is lot of scaling. So this is an erythrodermic type of psoriasis. In this psoriasis, because of lot of loss of the proteins and the loss of water, the patient is like to go in shock, and he can have water and electrolyte deficiency, and he can die, and he needs to be admitted in this inverse type of psoriasis, and it can cost his life also. So one should be very careful in this type of psoriasis. In erythrodermic psoriasis, one needs to be admitted, and usually this occurs if certain patient is under steroids for the treatment of psoriasis, and he stopped the steroids suddenly. The psoriasis can turn into erythrodermic psoriasis. It's a very severe type of psoriasis. Or if you are under some treatment and suddenly change the treatment, then also it's likely that one can land up in erythrodermic type of psoriasis. So one should be very careful while they giving the treatment, or to stop the treatment of the earlier doctor and give you treatment. It should be taken under the guidance of an expert only, not suddenly you can do it yourself alone. Or if you do it, you can land up in erythrotype of psoriasis. Then there is another rare type of psoriasis. We call it a posterior psoriasis. As we always tell that psoriasis is not due to infection, and there is no bacteria or there is no virus infection, but there is a posterior type of psoriasis. So we know that whenever there is a pus, there is an infection. It's very strange that psoriasis has a type that is called as the posterior type, and in this a patient gets pustules all over the body. He gets the abscesses, or he gets the vesicles all over the body that contain the yellow or white pus, and that pus is a sterile pus. It is not having any bacteria, it is not having virus, it's a sterile pus. And the type of psoriasis is called the posterior psoriasis. It is also a rare type of psoriasis. It is also dangerous as the erythrodermic psoriasis. We notice that in erythrodermic psoriasis there is a lot of loss of proteins, and there is lot of loss of water. The patient needs to be admitted. Here also in posterior psoriasis, the posterior psoriasis occurs all over the body, and patients should be taken care of, especially in the hospitals. For information, all these three rare type of psoriasis has been treated at Psoriatreat, and we are very having good results. And many times we not need to admit them, but they can be treated with homeopathy. This gutted psoriasis, the inverse psoriasis, the erythrodermic psoriasis, these are the rare type of psoriasis. They can be cured now with homeopathy. You can go and see all these photos of cured patients on our website. And definitely, if you have any more questions about the psoriasis, you can go to our website, see the information. If you have more questions, you can write to us. If you want more information, you can call us. Definitely, we'll be happy to answer all your questions. Thank you.